Good afternoon, everyone, and welcome to our IOSH South East CDM update. My name is Julian Mills, and I'm your branch chair. Our speaker today is Alastair Mitchell. Alastair is one of Her Majesty's Inspectors of Health and Safety within the construction sector and has more than 25 years' experience working for the Health and Safety Executive. For the first 13 years, he worked in the Field Operations Division, where he undertook a full range of frontline regulatory duties. He has experience of regulating a wide range of industries, including agriculture, engineering, general manufacturing, waste and recycling, and spent 7 years as a member of an operational team inspecting the construction industry. Alastair also has 12 years experience working in operational policy within HSE's Engagement and Policy Division within the agricultural sector. And in September 2019, Alastair joined HSE's Construction Division, where he currently works in the construction sector's Policy and Management Unit. Just to note that a recording of this webinar and a copy of Alastair's presentation, including any web links, so you don't need to write them down, will be posted on the IOSH website. So, without further ado, over to yourself, Alastair.
Good afternoon, everyone. I'd like to thank the IOSH South East Branch for giving me the opportunity to participate in this webinar with you all this afternoon. Today, I'd like to share with you some examples of the work HSE's Construction Division have been carrying out over the last 12 months or so. This includes work by our sector policy teams and also by our operational teams working in the field. Before I do that, I think it might be useful for me to bring you all up to date with some very recent developments impacting on the work of Construction Division. Firstly, in relation to the current situation with people returning to work in the construction industry and precautions against COVID-19, I think it's important for me to mention that there are now many sources of advice and guidance on practical steps you can take to manage the risks in the workplace. If you are from a construction-related business, there are a number of places you can go to get information and advice, including the main .gov.uk website, where there's guidance on working in the outdoors, which applies to construction activities. There's also the HSE call centre. We've extended the hours. That's now open until 10 o'clock in the evening, Monday to Friday, where you can go for advice. There's the HSE website, of course, where there's lots of information about our regulatory activity. And I thought I'd also mention that there are a number of very useful stakeholder websites where you can go for information, particularly the Construction Leadership Council. Some of you may be aware that they've produced some very good guidance on work, including precautions against COVID-19. And in fact, the latest draft, I think it's version 4 now, is on their website, which is available to download. The fifth bullet point on that list, construction COVID-19 response, is also very useful. For those of you that haven't visited that site, it contains a whole lot of information from construction companies outlining some of the measures that they've put in place on a whole range of different sites in order to keep people safe. And there are plenty of other websites as well. I've just included 2 further examples there, the CITB and also the CPA. The second point that I just want to mention very briefly is in relation to building safety. As I'm sure you're all probably aware now, HSE has been asked to set up the new building safety regulator, and a lot of work has been happening in the background to help us understand what that means in practice. We've been working very closely with the Ministry of Housing, Communities and Local Government to develop the legislation we need to establish the BSR. And in fact, from the 1st of May, a new Building Safety and Construction Division has been set up. So our existing Construction Division will become a distinct part of the new BSCD and will continue to focus on worker health and safety during construction and related activities. By joining CD up with the new division, we can continue our approach to regulation and take advantage of our links with industry stakeholders as we develop the BSR. It's quite likely that the new regime for building safety may draw heavily on the principles of CDM 2015 in, for example, establishing clear roles and responsibilities of those involved in the procurement, design, construction and refurbishment of high-risk buildings. And it makes sense to take advantage of Construction Division's extensive knowledge and expertise in these areas and of the synergies between the workplace and building safety frameworks to deliver safety outcomes for workers, residents, and the wider public. MHCLG are, of course, leading the work to draft the bill, and HSE has been providing some assistance and input to that. But as the draft has yet to be published, I'm unable to comment any further on what the bill may contain. The third point I just wanted to briefly mention is the post-implementation review of CDM 2015. You may be aware that the regulations do in fact contain a requirement on the Secretary of State to carry out a review 5 years on from the date that the regulations came into being. And colleagues of mine in my team have been working very hard on drafting the review and collecting data for that. And originally it was intended that the report would be published, I think, in the spring of this year, but unfortunately there have been a number of delays. Most notably, we had a general election and then, of course, COVID-19. So there is currently no time frame for the publication of the report. We're hoping it will be by the end of the year. But again, unfortunately, until the report has been published, I can't be drawn on any comments in terms of what the report may contain or any recommendations that might have an impact on any further revisions to CDM. Okay, let's get into what the presentation will cover today. Essentially, it's in two parts. The first part is really just to give you an update on where we are within the construction industry in terms of health and safety performance. And what I'll do is I'll give you a little bit of background, but then I'll move into discussing in a bit more detail a health initiative campaign that HSE ran last year. And then the second part of the presentation, I'll discuss some of the collaborative work that Construction Division have been doing with industry stakeholders. And that's chiefly through our engagement with CONIAC, the Industry Advisory Committee, and also with other stakeholders. So really just to set the scene, I think it's important that we just remind ourselves about the big picture. And so I've got some statistics here setting out the statistics involving fatal accidents in the construction sector 2018 to 2019. As you can see from this slide, the number of deaths in that year wasn't too far away from the average number of fatalities that had been experienced over the previous 5 years. And very disappointing, of course, to see that almost half of those deaths were from falls from height. Again, that matches the average over the 5-year period. But I think what's particularly of a concern is the fact that if you look at all workplace fatal accidents that occur across British industry, then about a quarter of those occur in the construction sector each year. Although the health and safety performance in the sector has improved significantly over the past decade, and we've seen a fairly general long-term downward trend in the number and rate of fatal injuries, the sector remains one of the most hazardous, accounting for, as I say, about a quarter of all fatal injuries to workers. It's truly shocking if you look into the detail. For example, the 5-year period from April 2012 to March 2017, almost 200 construction workers were killed in workplace accidents. And looking at the average of the last 3 years, each year, about 64,000 workers in the industry receive an injury at work, and about 80,000 suffer from work-related ill health. The majority of fatal accidents, sadly, involve small businesses, SMEs, and nearly half of all reported injuries occur in refurbishment activities. Risks on larger projects can, of course, be substantial, but generally speaking, the larger projects are better at controlling risks than most small projects. Despite the downward trend in fatalities, the level of incidents and ill health remain high, with some recent signs of the numbers levelling off, as you can see on this chart. Developments in the management of health risks, sadly, have not kept pace with safety improvements, and the sector has a statistically significant higher rate of occupational lung disease and MSDs than the average for all industries. So how does it compare with other sectors? Well, this slide just gives you an indication of health and safety performance by means of looking at the fatal accident incident rate. That's the number of fatalities per 100,000 workers in the industry. Probably no great surprise to you to see here that the fatal accident incident rate for construction is 3 times the all industry rate. And in fact, construction is second only to agriculture in terms of being the poorest performer. So of course, we do want to see a continuation of the downward trend in fatal accidents, work-related ill health and injury. And so it goes without saying construction will continue to be a priority sector for HSE. In terms of enforcement, then I've put this slide in because I think it's important that we recognise that there's a lot of enforcement still being undertaken by our inspectors in our operational teams. And in fact, for 2018-2019, just under 3,000 enforcement notices were served by inspectors during the course of their interventions. Approximately 1,300 were improvement notices and 1,600 were prohibition notices. And in fact, on the prohibition notice side, that actually accounts for around 60% of all prohibition notices issued by HSE. So it's certainly an enforcement-rich environment. During that particular year, there were 158 prosecution cases with a 92% successful conviction rate. And as you can see from that slide, the average fine was in fact in excess of 100,000 per conviction. So where does that lead us to? What do we conclude from that? Well, clearly construction will continue to be a priority for HSE. And hopefully most of you will have seen the sector plan for health and safety in construction, which is published on the HSE website. I haven't got time today to go through everything that it covers, but I just wanted really to pick out 3 key areas. As I said just a few minutes ago, we have a really big problem with the death and injuries on the smaller sites and the SMEs. So we want to continue supporting small businesses to achieve improved risk management and control. And also, the focus has to be on ill health. We can't just ignore health. We need to see a reduction in health, and particularly a focus on occupational lung disease and MSDs. And key to achieving the outcomes that we want at site level, we must ensure that we embed the principles of CDM 2015 with all duty holders. So it's not just the people at the sharp end, it's all the duty holders. We need to take a holistic view and making sure that all duty holders are fulfilling their roles adequately. And all of this, as I say, is set out in the sector plan for construction. By supporting small employers, yes, of course, we're going to continue to refine and update and improve our guidance. But small employers and small sites, they remain a challenge for us because we do find very poor standards very often when we visit them. And it comes as no surprise, I guess, that they're responsible for around 2/3 of all the fatalities that we have. And 1/3 of those are to self-employed individuals. Almost half of the riddles we get are from refurbishment work, which is the kind of work that you typically find SMEs engaged in. And as I mentioned earlier, falls from height account for about half of all those fatalities and 1/3 of all major injuries. And sadly, there's also the continuing burden of ill health. So the challenge that we face in the industry, I think, is this. We need to treat health like we treat safety. We need to ensure that we have in place adequate measures to manage health risks, because ultimately that should be no different to managing safety risks. And it is possible and it is practical to carry out work without causing ill health. And crucially, everyone has a role to play. It's not just about the person at the sharp end on the tools. Everybody must take ownership of their part of the process. So what can HSE do? Well, HSE decided last year that it would run a health inspection initiative. And this would be run in essentially 2 campaigns, which I'll come on to in a moment. The reasons for this, well, it's within the overall HSE priority plan, particularly in terms of tackling occupational lung disease and MSDs, and it was also within the CD construction sector work plan, as I mentioned a few moments ago, in terms of securing the effective management and control of risk. So on that basis, we committed to run 2 national initiatives. We know each year around 3,000 workers in construction suffer with respiratory problems. And we also believe that for every worker killed on site, approximately 100 die from ill health due to past exposures, particularly in relation to asbestos and silica. So we decided in this campaign we'd focus very much on respiratory risks and their control. We'd be looking at asbestos, and we'd also be looking at a variety of dusts. Our inspectors in the field were also instructed that they were to deal with any other matters of evident concern, and also to focus on ensuring that welfare was adequate. As I say, this was to be a national inspection campaign targeting a whole range of sites where at least one significant respiratory risk was anticipated. And crucially, we decided that we wanted to get a broad range of data from our visits. So no sites were to be excluded. We were not just focusing on small refurbishments or domestics. We were looking at a cross-section of sites right across the board, using local knowledge, using our F10 notification database in order to maximize our operational efficiency and impact. The campaign was run in 2 phases, one in the summer, one in the autumn, and we gathered the data from that, which we then were able to analyze. We carried out almost 1,700 inspections in that time. And looking at the data afterwards, we found that overall the material breach rate was 53%. An inspection was considered to have found a material breach if the visit resulted in the issue of a PN, an IN, or a notice of contravention. As you can see, the breach rate generally decreased as both duty holder and site size increased. And probably no surprises, domestic refurbishment had the highest material breach rate at 65%, and new build commercial the lowest, but still an interesting 46%. In terms of compliance ratings, I've put this slide in because I think it's quite useful in terms of giving you a broad indication of the level of compliance on a whole range of topics. So if you look at the column, the column with the number 1 at the top, a number 1 compliance rating is given for sustained compliance. So in other words, what it's saying is, for example, with work at height, where that topic was encountered on site, 31% of the working at height received a 1 rating, indicating sustained compliance. So everything that's to the right of that, so that's ratings 2, 3, and 4, are varying levels of non-compliance, with 4 being the worst rating. And of course, inevitably, although this was a health initiative, sadly, on a number of sites, the safety failings were discovered to be so bad, and action had to be taken to deal with safety issues, that health issues were unable to be prioritized or followed up. In terms of enforcement, as you can see from the campaign, 460 enforcement notices were issued, broken down as you can see on that table, 222 improvement notices and 236 prohibition notices. If we look more specifically at health risks, because that was a fundamental part of the campaign, you'll see that in terms of enforcement, if you put aside welfare for a moment, silica, 25 improvement notices, 23 prohibition notices, so 48 in total on silica. Very disappointing figure that is. I'll go through some of the reasons for the serving of the notices in just a moment. Also, you can see asbestos resulted in 26 notices. Looking at some of the issues that inspectors found on site, with asbestos, we had a 73% compliance rate, but nevertheless, we still had 26 notices served. And as you can see on this slide, the key non-compliance is related to surveys, either missing or inadequate. Others were relating to work on asbestos cement sheeting and the lack of awareness training. Silica, only a 51% compliance rate, 48 notices, and key non-compliance themes. I guess no surprises. You can see in that photograph, fairly typical example of using angle grinder or cut-off saw without any dust suppression, wrong RPE or lack of face fit testing, dry sweeping, a whole range of issues. And similarly with respiratory sensitizers, where we only had a 37% compliance rate. This is mainly in relation to woodworking, carpentry, 17 notices and key non-compliances, again relating to cutting activities with power tools, lack of extraction, wrong type of RPE, or RPE missing altogether, lack of face fit testing, and dry brushing and sweeping. So I guess probably no surprises, but nonetheless, extremely disappointing to see the failure to provide so many basic precautionary measures. Well flare, 72% compliance rate, but nevertheless 49 notices issued. I just cannot believe that we can't get adequate toilet and washing facilities in this day and age. Unbelievable, some sites still without any facilities at all, or some sites where the facilities that were provided were wholly inadequate or inadequately maintained, sometimes no flushing toilet, lack of running water, all sorts of potentially straightforward issues that hadn't been resolved, resulting in enforcement action. So then, just to kind of, I guess, summarize, what does this tell us? Well, it's given us a snapshot of the industry, and the chances are that if we went out and carried out the same intervention again, we'd get the same results or very similar results. The risk profile of the industry hasn't really changed that much. I mean, I was inspecting construction 20 years ago, same problems 20 years ago, same problems today. Work at height, in particular, in the small refurbishment jobs, it's a classic enforcement scenario. Lots of enforcement action required to address fairly basic failures to manage work at height correctly. The frustration is that the industry knows what's wrong and has known what's wrong for a long time now, but it needs to take more fundamental action, do something positive about it. And we do believe that improving things goes beyond simply regulation and guidance on what to do. HSE has produced tons of guidance over the years, and other duty holders have done the same. But we need to go beyond that. We need to take the next step, because it's really about changing hearts and minds, behaviours and relationships, if we really want to make a difference to those awful statistics that we saw near the beginning. So again, turning to our priorities, yes, we're going to continue supporting small businesses so they know how to achieve improved risk management and control at site level. And we must work harder to reduce incidents of ill health, with a particular focus on those occupational lung diseases and MSDs. And important that we do continue to embed the principles of CDM 2015 with all of the duty holders. When I talk about embedding CDM, then I think it's important that we look beyond simply the contractors working on site. We have three key priorities within CDM. This is really adding clarity to our priorities. The inclusion of the client, of course, is vital, but we need to find new ways of persuading and engaging with disengaged clients. We need to persuade clients and their advisors that investment in planning the pre-construction phase will pay off. And in design and planning, we need to share our learning through our own experience of engaging with duty holders and what we believe is emerging as best practice in complying with CDM. And as digital technology moves forward, we're beginning to find that these could potentially be a huge benefit for designers and principal designers in carrying out their planning, management, and coordination roles. And we hope that as we go forward, we'll be able to share with the industry how these can contribute and inspire designers and principal designers to use and develop these tools. So how are we going to do that? Some of these objectives are things that HSE can try and do alone, but most of them are going to involve some engagement with the industry. How will we achieve what we want to achieve? Well, HSE has a long and well-established history of working with the construction sector stakeholders, and one of the best ways that we do that is working through our industry advisory committee, CONIAC. CONIAC, as you probably know, has a number of working groups. Those working groups are aligned to delivering the Help Great Britain Work Well strategy. And so they're organised under the 6 themes that are in that strategy, as you can see on this slide: acting together, tackling ill health, managing risk well, supporting small employers, and keeping pace with change. The Sharing Our Success group actually has been disbanded, but their work is being marbled through the work of the other groups. We also have CONIAN, which is the Construction Industry Advisory Network, which provides a platform within this structure for participation and involvement of other stakeholders with responsibility for managing construction risks. This next slide really just is there to indicate that we have a number of work streams that these working groups are tasked with undertaking. And this particular slide shows a whole range of projects that are being carried out in the designer work stream. Unfortunately, we don't have time to go through all of them today, but if I could draw your attention to the left-hand side of the slide, you'll see we've got a reference there to BIM for Health and Safety Group and BIM and Digital. And that's something that I want to share with you a little bit more this afternoon. But clearly, as you can see from this slide, there's a whole range of projects and work that's going on involving collaboration with the industry. Before we talk about BIM, I just want to really remind ourselves about the key functions of the principal designer within CDM 2015, and particularly about risk, identifying and tracking risk, scrutinizing how risk is being treated. Is it being eliminated, reduced and controlled, and what information is being provided, particularly about residual risk. The importance of coordinating with other designers and their risk mitigation measures, and then crucially, handing over designs at the end of the day, which can be constructed safely. So if we can try and keep those in mind when we're considering the application of BIM. What I'd like to just run through now is a slide which relates to an agricultural barn that was being converted into residential use a few years ago. Very sadly, 2 workers died when the gable end wall of this barn collapsed. HSE investigated and found, as is often the case, this was an avoidable tragedy. It turned out that the wall that collapsed, and in fact the building, had been surveyed and information recorded about the risks of working near this wall. The information was in a report, but that information never reached the people who needed it, who were planning to carry out the work in detail on the site. Crucially, the right information never reached the right people at the right time, and 2 people died. This slide shows a very simple reconstruction, a model that was produced by HSE using some fairly basic scanning and modeling techniques very familiar to BIM practitioners. It was produced for the resulting court case following that investigation to help the jury of lay people and the judge understand the causal chain of events. With this model, it was easy to see where things went wrong and how things could have been done differently. The tragedy was easily preventable. So with this in mind, a question for clients, for principal designers and contractors: do you have confidence in your critical health and safety data, not just in terms of the content, but how it's delivered, how it's presented, and is it understood? Is there potential for confusion? And most importantly, how will we protect harm? Well, one of the areas that we've been paying a lot of attention to in the last 12 months or more is in the area of business information modeling, or BIM, for health and safety. It's not a new tool, it's been around for a while. And of course, with that example of the small barn that collapsed, we had a model there looking at things with the benefit of hindsight. But essentially, BIM is a tool that enhances foresight. It provides a line of sight from the earliest opportunity in the design process to identify a risk through the construction phase and then into future maintenance and use. A number of real positive advantages of using BIM: the power of visualization, the fact that it facilitates collaboration, improves learning and understanding. I guess at the end of the day, the big argument is that by doing more planning and design in the pre-construction phase, then the construction will be made safer. So the overall message to designers and principal designers, I guess, is that BIM tools can prevent harm and help you do your job in fulfilling the aims of CDM 2015. The benefits are not just for the larger projects. Projects of quite modest size can benefit from the improved precision of design and the ability to enhance collaboration within project teams that information modeling provides. We are learning all the time with this, and we're learning particularly from the experience of others who've applied this in practice, but there is evidence that on those projects with forward-thinking clients and those that adopt BIM and digital design technologies, these tools are making a difference to the quality of risk management, and in particular, coordination of risk information in design. Of course, where issues are not addressed early on, projects can be delayed, and it can become significantly harder for contractors then to have to devise safe ways of working once they're on site. There are various digital tools which are being used to enhance the principal designer role. And in a moment, I'm going to take you through a case study. This is a really good example of the use of digital tools, incorporating a whole range of fancy features. I'm conscious that many of you may not have heard of phrases like clash detection and rule checking in models, so I'll try and keep the jargon to a minimum. But essentially, what this case study shows us is that it's a particularly effective use of digital technology to enhance the principal designer role. So what we have here is a construction client, the National Grid. We have a principal designer in the form of Premtech, and we have a contractor, Murphy's. And this relates to a series of projects undertaken in 2017, 18 and 19, where Murphy's were involved in building various gas transmission installations for National Grid. And Premtech pioneered the use of what they refer to as digital rehearsal, which I guess you could define as practicing construction to prevent accidents, or to rehearse and to de-risk. They worked in close collaboration with their client and with the contractor Murphy's during the early stages to construct accurate and realistic design models in 3D, and they also used 4D sequencing extensively to check and test construction sequences. So as you can see with this slide on the screen in front of you here on the left, you have an image that's the result of their efforts. It's a digital image of the site. They used drones extensively. The image on the right is actually a photograph taken by a drone of the site once it was in operation. Digital visualization and rehearsal took place months before the work actually started, but it allowed clarity. It allowed visualization by all the parties, including the contractor and the subcontractor. And it was very important that they involved workers in making decisions about health and safety at this early stage. Premtech provided all the digital technology, but it's a really good example of a powerful partnership led by the client to achieve positive outcomes. Using these techniques proved highly effective, with over £25 million worth of work completed over 3 separate projects in 3 successive years without a single RIDDOR reportable accident. For the use of plant, laser scanning was used to create digital models using a product called Unity, which is a gaming software product, to create a digital plant library with over 160 data-enriched smart models of plant. Each of those included their size, weight, capacity, reach, and so on, so that it was possible to decide which items of plant would be best suited for particular aspects of the work. In this particular slide, the designers worked out that they would need to use a compact excavator, but in order to allow it to enter and exit the working area, a ramp would need to be provided. This was factored into the design. Murphy's, the contractor, were involved at an early stage, and using the digital plant library, they were able to select a suitable machine and were able to calculate the size of the ramp that the machine could safely negotiate. This eliminated problems in advance, so it was not left to the contractor to devise a solution or manage the risk. Also, what proved particularly invaluable was the fact that they were able to produce these very, very detailed images of what the site would look like at various stages of the project. And not only did they use the drones to create images of the site at various stages, but they were also able to produce very detailed models featuring rules-based clash detection, which is essentially a piece of software which enables you to calculate accurately and locate separation distances, hazard zones, exclusion zones, and so on. And this is one of the key benefits of digital rehearsal. As part of the work that they were doing and to provide the construction teams on site with useful detail, a key aspect of this particular project was to create photorealistic posters and boards well in advance of work being undertaken. This included for temporary works and was able to be used to form part of site inductions and toolbox talks for workers on site. So a very valuable means of communicating information and illustrating to workers what the site would look like at various stages of the build. Taking things forward one step further, National Grid realized that these technologies could potentially have a benefit for a whole lot of routine tasks that they were required to undertake. In this particular slide shows a task to replace a joint between pipes where the pipe sits on a plinth. They'd previously had an accident when they'd attempted to remove the plinth in order to do the job. So what they instructed Premtech to do was to use digital technology to rehearse a whole series of alternative options in order to devise a safe system of work. In the end, they came up with a solution involving a diamond cutting tool to remove the plinth. But essentially, I put this slide on to show how it was used to develop RAMs and safe work procedures, which could then be shared with the contractor, so the contractor could see quite clearly what the risks were and how the job could be carried out safely. Finally, just to mention the digital health and safety file. This was another benefit that this technology brought to the project, in that National Grid were able to collate information about the project. Documentation was scanned and uploaded, and then using this very sophisticated software, they were able to create a digital model of the plant. And within the model, they were able to embed all the relevant health and safety documents that were needed to form part of the health and safety file. This was fully compliant with National Grid's own internal systems and procedures, but made the information readily accessible to the end user. And using the digital technologies like this also enabled the work to be done safely and quickly. So to sum up then, from this Premtech case study, the key benefits that were reported by all the duty holders participating in the project. Firstly, the reduction of accidents. As I said earlier, a 3-year project without a single RID or reportable incident. And all parties reported improved collaboration. There was much better alignment of risk perception by all the parties who were working on the project, improved process safety, communications, and worker engagement. There was much better coordination of temporary and permanent works, and as a result, improved cost and program certainty. Okay, that's been a very rapid fire run through BIM and the use of digital technologies. I'd now like to just talk very quickly about some other initiatives where HSE and industry have been working together through CONIAC. And if you remember, one of the key objectives was about supporting SMEs in terms of giving them the tools they need to manage health and safety risks more effectively, and also to provide further assistance for clients so that clients are aware of the duties. So I'll now very briefly take you through 3 other pieces of collaborative work. The first of these is the Client Buddy Scheme. And this was a project that's been running under the guidance of the Construction Clients Leadership Group, the CCLG. And essentially, the CCLG have established a website with information which is specifically for business owners who may be embarking on a construction project for the first time, taking on the role and the duties of a construction client under CDM 2015. The purpose of the scheme is to equip clients with the knowledge they need to engage successfully with the construction industry, to help them understand their responsibilities and to provide them with advice and guidance. Ultimately, also, the scheme provides clients with what's referred to as a client buddy. That is to say, an experienced construction client who, via a 10-minute phone call, can offer free impartial support and advice. Of course, there's loads of good quality guidance material out there to business owners that find themselves becoming construction clients, but let's be honest, it's not always easy to find what you need, and often the guidance is written from many viewpoints. But on this site, you'll find information that's relevant, that tells clients about common pitfalls to be aware of, and provides examples and standards on a range of topics. It also signposts clients to where they can get professional support. And for any construction client who still feels baffled, who still has questions, then the scheme offers the opportunity to connect with one of the scheme's volunteer client buddies. So by simply filling out a form, you'll be matched with a buddy who will make contact for an initial chat by phone. The purpose is not necessarily to act as an unpaid consultant, but rather to give hints and tips and to signpost to where a construction client can get further advice. Who are these buddies? Well, they're experienced construction clients who are members of the CCLG, and they're dedicated to helping other clients with a view to improving standards across the industry. So potentially, this is an excellent way in which clients who are unfamiliar with construction can find out what they need to do. We have staff from Royal Mail, Highways England, managers from the Crown Estate and Heathrow Airport, who are able to provide advice as part of this scheme. The other issue I want to mention very briefly is in relation to the planning portal. We commissioned some research on small businesses and clients in the construction sector a few years ago and found that small businesses use a very narrow range of sources of information about health and safety regulation, or they don't use any at all. And the health and safety information that they do generally look at, they found to be too technical and inaccessible. And so there was this desire really amongst SMEs for health and safety information to be more accessible, to be simple, jargon-free and more visual, and to be on websites that were easy to navigate. So with this in mind, we approached the planning portal. And as some of you may know, the planning portal has been around quite a few years, but it's helped to transform the planning process, making information and services much more accessible for users. It's the national home of planning, building regulations information, and the National Planning and Building Control Application Service. So in many ways, it was the natural place for us to try and embed key health and safety messages within the portal, and an excellent opportunity to influence duty holders at the earlier stages of a project. So we've worked with the planning portal on their interactive tool. As you can see on the right, we have a number of properties that's part of the interactive house. The idea being that if you're interested in doing roof work or if you're interested in doing excavation, you click on a relevant section of the interactive house, and it then takes you to information that you need to know that's relevant to that topic. So what we've managed to do is to incorporate health and safety advice for a whole range of typical projects such as roof work, underpinning, excavation, and so on, so that people who are accessing this information are readily able to understand what precautions are necessary to enable the work to be done safely. Moving forward, the next step is to embed further links to guidance and promote services such as the Client Buddy scheme. And finally, the last example that I want to share with you this afternoon, which I think is very relevant, relates to working at height. As we saw from the statistics near the beginning of the presentation, about half of all construction fatalities are in relation to falls from height. Well, this is a piece of work that's been undertaken under the Managing Risk Well working group within CONIAC. They created a subgroup to focus on the topic, and they were able to draw from industry bodies, trade associations, and representatives of other working at height trades. And they were tasked with considering a framework for creating safe working at height guidance. They were able to do this. They developed what's called the Safety Steps suite of documents, and you'll find these hosted on the Access Industry Forum website, where they're free to download. So in essence, it's a series of steps that takes you through the working at height scenario, but crucially, there are different messages there for designers, clients, managers, supervisors, and operatives. And a key aim of the work was really to produce documents that were fit for purpose and that could be regularly updated to make sure that they were current, valid, and up to date, a long-term reference point for industry. And although Safety Steps contains fairly general rather than task-specific messages, so for example, they don't provide information about specific situations where you use scaffolding or mupes or working on roofs, they give you essential messages that can underpin any type of work at height activity, and these can then be used for toolbox talks, training materials, and so forth. So they have a whole series of information sheets that you can download free of charge, one for designers, one for clients, one for managers, one for supervisors, and of course, crucially, one for those who are actually carrying out the work at height. Right, that brings me to the end of my presentation this afternoon. I'm sorry it's been a very, very rapid run through some of the work that the construction sector has been engaged with over the last 12 months, but I think it's important that I just quickly sum up, and that's really what I've got on the next couple of slides. This afternoon, I've given you an update on the health and safety performance of the construction industry, and we've seen that it continues to experience an unacceptably high level of accidents and ill health. I've also shared with you the outcomes from HSE's intervention at site level in 2019. And that shows us that basic health and safety risks are very poorly managed. And I think hopefully we'll all agree that the industry needs to take more fundamental action to do something about improving this. It's not just down to the regulator alone to make a difference. And improving things goes beyond regulation and guidance on what to do. And it is about changing the mindset. It's about changing behaviors and relationships at all levels. And that's why continuing to embed CDM 2015 with all duty holders will remain a key objective for us as we go forward. Of course, we will continue to provide support and hopefully influence SMEs at site level to improve health and safety performance. But we do need to put more effort and more work into influencing clients and principal designers to share with them the benefits that we're finding from BIM and digital technologies that can be used in a practical way to reduce risk at site level. This is a huge challenge for us, but we're looking forward to the challenge, and we're looking forward to working with the industry to hopefully make a difference in terms of reducing accidents and ill health on site. Thank you very much. That concludes my presentation. Julian.
Thank you very much, Alastair. It's a very interesting presentation, and excuse me, and it has generated a storm of questions. Okay, so Alastair, do you think the majority of these deaths, or what percentage of the majority of the deaths within construction do you think are down to a failure on the part of the principal designer and or the designer?
That's a very good question. And I think the honest answer to that is it would be very difficult for us to say that that was the case in all of those fatalities. Clearly, designers have a key role to play in managing risk and passing on information about residual risk to those that are working at site level. And clearly, contractors themselves have obligations to manage risks on site. But one of the challenges that we face, and something that we're doing more of as an organisation, is tracking back. So, for example, if we're investigating an accident on site, it might not necessarily be a fatality, but if it's a serious accident, then inspectors now are being instructed that they are to go beyond looking at the actions of the contractor, but to go back, track back and see what information the designer had provided, and to see whether the designer has adequately fulfilled their duties under CDM and the principal designer and client. I think it's important that we recognize that CDM is very much about a holistic approach, that we need to look more fully at the extent to which all of those duty holders have fulfilled their duties in any accident investigation. But in terms of me being able to say to you, okay, well, we've had 30 odd fatalities in a year, how many of those were down to the designer? That is a very, very difficult question to answer.
Okay, thank you. There's another question here related to mental health, and Kevin is asking what your views are in terms of the focus on mental health as opposed to the more sort of conventional focuses like falling from high.
Well, yes, that's again a very good question. We know that mental health is a huge issue across all industry, and particularly in construction. And it's a very difficult one for us as a regulator to deal with, because, to be honest, people can be suffering from a whole range of mental health conditions. Some of those may not necessarily be related to the workplace, but yes, it is an issue, and yes, we are aware of it, and we are very keen to work with stakeholder organisations and provide signposting to where people can go to get advice and guidance to help them. We are by no means experts in the field of mental health. I think our role really is, where we become aware of it, to signpost organisations and individuals to places where they can get more expert advice. It's a very difficult area to tackle, but yes, we are aware of it, and it's certainly going to be something that will require more resource to tackle as we move forward. Clearly, COVID-19 has had a big impact in terms of people's mental health and well-being. And so going forward, I think, yes, it's likely to be a very big issue for us in the future.
Okay, thank you. To what extent should a principal designer review a design work by another designer? So, for instance, a structural engineer or an M&E design, as these require specific knowledge and experience, which not all principal designers would have.
Okay, again, another good question. And I think the answer to that is that for many projects, HSE see the role of the principal designer being fulfilled by an organisation rather than an individual. and that within that organisation, ideally, you would have a broad range of skills, knowledge and experience that would enable individuals within that organisation to make a valid contribution at various stages of the project, which could include reviewing information that's been provided by other designers. So I think the answer is that we do see the PD role as being ideally an organisational role rather than a role that just falls to one individual. And of course, there's always the opportunity to bring in specialist expertise as and when required to deal with particular aspects of the work.
Okay. There's one here which sort of touches on the current crisis we're all facing. At present, companies are scrambling to find any type of P2 and P3 masks. Operatives almost definitely won't be fit tested for these due to the close proximity to do the test. And if the job has to be done, for instance, assisting key worker company, what's the HSE's take on this?
Okay, well, I guess the starting point really is just a bit of a reminder in terms of the hierarchy of risk control, because the use of masks is always at the bottom of the hierarchy of risk control. So it's really about evaluating whether the work can be done in a different way in order to eliminate the risk, so that you don't have to rely on PPE. But of course, as you say, given the current situation, PPE is very much an issue at the moment, and we do appreciate that there are some difficulties in obtaining PPE. What I would say is that HSE is actively engaged in doing a whole lot of work looking at PPE at the moment, and not just in terms of availability and supply, but in terms of how well it works and making sure that we provide the relevant guidance to industry. And in fact, I think if you look at the latest guidance from the Construction Leadership Council, their safe operating procedures, I think there's some further clarification there about PPE and tasks where PPE is or is not required. So I guess that's probably not a very helpful answer, but essentially it's very much about horses for courses, looking at the particular task in hand and seeing whether it could be done in another way in the first instance, rather than automatically choosing RPE as being your first line of defence.
Yes, I think there's a number of areas where current situation is causing questions to be asked over this conflict between trying to reduce the risk from coronavirus, but at the same time not wanting to contravene any legislation. For instance, propping fire doors open to reduce the contact on the handles in opening the doors.
Yes, I think also it's fair to say that this is very much an evolving situation. The guidance is being revised and updated as we know more about the virus, and as more sites become active, that guidance and advice is being regularly reviewed and updated. And as with Public Health England and their guidance, we recognise that it's not a one-size-fits-all approach. There's going to be some very difficult scenarios and some difficult challenges for us to be able to say, this is the definitive guidance. But it does very much fall back on employers undertaking their own risk assessments and then using the guidance that's available to help them come to the right decisions about what precautions are needed.
To what extent do you believe that the fee for intervention has dissuaded employers from contacting yourselves for advice?
Yes, now that's a good question. A very interesting one, actually. I think that, of course, FFI's been around for quite a while now. I think it first came in 2012, and so it's most duty holders now are thoroughly familiar with the way that FFI operates, and I wouldn't necessarily agree that it dissuades people from contacting us for advice, because, of course, there's lots of information on the website, and lots of information that we share with other stakeholders. I don't think there's a reluctance for organisations to come forward. I think organisations still see HSE as a trusted source of advice, and they recognise that if they're compliant with the law, then FFI is not going to apply. It only applies where there's a material breach that's been observed by an inspector or a visiting officer. So I think particularly at the moment, I wouldn't want to discourage organisations from coming forward and asking for advice. our advice is still free at the moment, which is a bit of a rarity these days. And so, no, I wouldn't necessarily agree that it's dissuaded people. I think perhaps it may have done in the first couple of years, but now that the FFI process has been in place and is well established, I don't think that that would stop people coming to us for advice.
Okay. There's another interesting one here. Apart from providing an R&D survey in the PCI document, as principal designer, is there anything else the principal designer needs to know? This question is just trying to gauge how far to go in providing information and what the principal contractor does with it.
Right. Okay. I think I'm going to suggest that the answer really lies in reading what's in L153, which is the principal piece of guidance that we have on the CDM regs. I'm sure many of your members are probably familiar with the document, but that's really the starting point in terms of looking at roles and responsibilities and what information needs to be provided. So I think it's very difficult for me to answer that. I mean, the one thing I would say is that important to remember about proportionality, because the amount of effort that's required, it all needs to be proportionate to the risk. You know, we don't expect huge effort where there's a minimal or insignificant risk. Clearly, where the nature of the work involves significant risk, then we would expect a more proportionate response in terms of what needs to be done. So I guess I'm possibly not giving a detailed answer, because it really does depend on the nature of the project in terms of what information should be required. But I think what is important to say is that as we were looking at with the BIM and digital tools example, that's an excellent example there of people collaborating and sharing information. And I think that's very, very important that we don't lose sight of that one of the key requirements is about not only assessing risk in the PD role, but making sure that that information is shared more widely so that there is a common knowledge and common understanding, particularly of residual risk. Okay, thanks. I'm just going to ask this last question. It's from some small builders. Given that you know, you've identified them as being at a greater risk within the presentation, it seems appropriate to give you the opportunity to just reinforce the answer to this question. He says, we're small builders who conduct small jobs that may fall into CDM. Are there specific guidance documents, links regarding the scope or known changes in this area? We know a lot of similar builders who have limited knowledge of this. Yes, absolutely. There's some very good information available to help SMEs, smaller builders, and so on smaller projects. I mean, for example, on the HSE website, we've got a whole lot of really good information there that's specifically targeting small builders. So that's a really good starting point, is to go to HSE. We've got a whole series of busy builder worksheets and other information there. Also, the CITB have a really, really helpful app, I believe it is, which allows you to get access to information readily on site. So yes, I mean, there's stacks and stacks of information, but the starting point really is if you go onto the HSE website, follow the links from construction, that will take you to a whole lot of guidance. And for example, if you click on the link for small builder, there'll be a whole lot of information there, not just about CDM, but it does give you an example of a construction phase plan and things like that, with all the things you need to know as a busy builder, all the things that you need to consider to comply with the duties. There's even a kind of template that you can use, which takes you through all the various things that you need to consider to help manage risks on the site. So yes, there's stacks and stacks of useful information on there, but I would say the starting point is definitely the HSE website. Okay, thank you very much, Alastair. It was a brilliant presentation, and it's certainly the audience have found it very engaging. There are a lot of questions that we just simply haven't been able to answer here, but what I will do is I shall make sure they're forwarded to Alastair, and we'll hopefully be able to post the answers to most of those questions on the website once we put both the presentation and the recording of the webinar up there.
We've also received a number of compliments on the presentation, Alastair, notably one from Kieran Delaney in Ireland, one of our IOSH Council members. So I think the audience found it very beneficial. We will be sending the link to the presentation and the recording via email next week. Our next webinar is on the 15th of June and is on the subject of shift work and the impact on wellbeing. Detailed information will come out again via email next week. So, thanks again. Much appreciated.
Thank you, Julian. I hope that your audience has found it useful, and I would certainly welcome another opportunity in the future to speak to the group, hopefully in person rather than remotely.
Yes, hopefully that won't be too far off, and we will clearly send you an invite, Alastair. We're always looking for good speakers.
Thank you very much.
And just in closing, I would just like to also thank the IOSH team who have hosted and supported us in this production. Thank you all for attending. Cheerio.